welcome to another episode of Parenting in the Far North. I'm your host, Ariane Aramburo. So today's guest is the Executive Director of Beacon Hill in Anchorage. It is a statewide nonprofit that serves, supports, and encourages Alaska's children in foster care and children at rise of entering into foster care. She's passionate about engaging the community to fill the gap for vulnerable children in Alaska and has been helping children and families since 1994. She's also gained experience as a foster parent, educator, and author, and mom to 3 children who are now young adults. Please welcome Kristen Bierma. Did I say it correctly?
You did. Yes, thanks for having me.
Well, thank you so much for being here today. So, Kristen, before we get started into the topic of foster care in Alaska, I would love to hear your experience, what it was like becoming a mom for the first time.
Yes. Well, we raised our 3 kids here in Alaska. They were all born and raised. And it took us a while to have kids. We were married for about 7 years. We had some challenges with fertility. Mm-hmm. And so when our first was born, it came with great delight and celebration and joy. And also kind of being overwhelmed with being a mom for the first time. Thankfully, we had great community up here. We had great friends and family and just really did life together and learned how to parent. And then we had 3 children in 4 years. And
okay.
So, yeah.
You were messing around.
Not messing around. I'm not sure I'd recommend that. So definitely we're just kind of thrown in and kind of grew up with our kids.
And did you go through any postpartum, feelings afterwards, or were you aware of that? What was that like around when you were having your children?
Honestly, I think because we had the 3 babies in 4 years, it was all a little bit of a blur. Mm-hmm. I look back on our old home videos and I see things that were happening and I have no recollection of, I think just having that many kids in a short amount of time. So I don't remember necessarily postpartum depression, but I do remember just kind of this feeling of being overwhelmed. Mm-hmm. I very clearly remember my kids were early risers, so they'd wake up at 5 or 6 a.m. in the winter. And as we know, the sun doesn't come up till 10 a.m. And I remember thinking some days, we're not going to make it till daylight. And just gathering them up and sitting on the floor and playing and singing and just doing whatever we could to get till daylight so that we could go outside for a few minutes.
And I bet as they got older, though, they all kind of became friends and entertained each other.
They really did, and they're still good friends.
So thank you for sharing that story. I know you are big into the foster care here in Alaska, and that's such a great topic to talk about. I'm so grateful that you came on to want to talk about that. I just want to know, how did you decide that you wanted to get into that field?
So it was a little bit by accident. Mm-hmm. We had been walking alongside some struggling families and just not really sure where it would lead. We were not planning on going into foster care. And one afternoon, I will never forget, I was in the carpool lane picking up my daughters from school, and I got a call asking if we would take in 2 children. And so that night, we did. We said yes, thinking it was going to be temporary until an actual foster home could be found. And temporary 2 weeks turned into 2.5 years. And
Wow.
We became emergency licensed as foster parents. And that really began our journey and kind of opened our eyes to the whole world of foster care. But it felt very sudden, very unexpected.
What was that transition like? How did, obviously you deal with that. How did your kids deal with that?
It was really challenging, to be quite honest. My kids at the time were 9, 11, and 13. Mm-hmm. We were very much involved in all the things, sports and ballet and running here and there. And to all of a sudden have 2 more children enter the home. They were 6 and 7. And they came with some history of trauma. And that kind of rocked our family. It was very challenging. I'm a therapist, mm-hmm. and so you would think that I would have been prepared for that, but it really was probably one of the hardest things our family had ever done. But we also grew a lot from it, and a couple of my kids are pursuing fields as adults because of having children in our home that had trauma. So I do believe it had a profound impact on them, but positive.
What was that like after you said 2.5 years? Mm-hmm. When they had to go, what was that feeling like for you and for your family?
Definitely grieving, some loss, a little bit of relief, mm-hmm. Because it had impacted our family so much, but really just wanting what's best for them as they transitioned out of our home.
Wow, that's amazing. Talk a little bit about foster care here in Alaska. How do we compare to the rest of the country?
Yeah, so if you're a child in Alaska, you're twice as likely to enter foster care as the rest of the nation. So we have, unfortunately, some of the highest numbers per capita of children in foster care. There's about 2,600 to 2,800 in care at any given time, up as high as 3,000 right now. I think as of January, there's about 2,600 kids in care.
Really? So what can people do if they are curious, they want to enter into this field, they maybe want to be a temporary, foster parent or go, lead into adoption? Where does one begin? Where is the need? Where would you like to see that?
So there is a huge foster home crisis right now. They're having an incredible shortage of homes. So it is a huge need. And the best place to start is a website called Alaska Center for Resource Families. That's where you begin. You go to an orientation. They walk you through the steps. They teach you everything you need to learn. They help you fill out the application. And so that website is acrf.org. And that is across the state. If you're interested in becoming a foster parent, that's the place to start.
What things are you seeing that are putting children at risk of entering into the foster care system?
Social isolation is probably one of the number one reasons why parents are at risk, right? Parenting is the hardest job on the planet.
It is.
And if we do it without support, without a circle of support, we're at risk. So even if it's something like a medical emergency and you have no one to take care of your children, for example, you're all of a sudden, maybe you're a single parent or your husband's in the military and you end up in the hospital and there's no safe option or no family member, no neighbor, no auntie to take care of your kids. Sometimes in that situation, a child enters foster care, not because of neglect or abuse, but because that parent is socially isolated and has no circle of support. So that's one thing that puts people at risk, is not having a social network. Another thing is, just not having as you don't have a social network, not having some of those skills to parent. A majority of kids go into foster care not necessarily because of abuse, but because of neglect. So it could be they don't have stable housing or they've lost their job. Maybe a parent is living in their car and they just don't have the resources and the support to take care of their children. And so sometimes in those situations, the children go into foster care. So one of the things we do at Beacon Hill is we have a program that helps prevent that. So surrounding people in crisis prior to state intervention being needed, because sometimes that's all that's needed is just the support in a crisis to keep them from having their children enter foster care.
And talk a little bit about that, Beacon Hill, what you guys do. I know it's support advocacy. Like you said, you rally around some of these families to help maybe kids not have to go into the foster care system. So what does that look like if a family is in need of help, or maybe they don't necessarily know it, but a friend wants to reach out and say, hey, this family could use some support?
Yeah, so we have 3 programs, actually, statewide programs that serve and support families in different ways. Our prevention program is called Safe Families for Children. So any parent in crisis can call our 24-hour helpline and reach out for help and say, I'm facing something really hard right now and I don't have anyone to take care of my kids. And we match them with highly vetted individuals who take care of their kids temporarily until they can get back on their feet. No judgment, just parent to parent. We all need help sometimes. And Safe Families operates in Fairbanks, Matsu, Anchorage, Homer, Port Allsworth, Whittier. So we have homes all over the state that just take care of kids for a week or two and hopefully help surround that family, give them some social support, and help them get back on their feet. The top 2 reasons we host kids in safe homes are medical emergencies and homelessness. And then we also have 2 family support centers, which really focuses on supporting kids once they're in foster care. How can we support that family? How can we surround them? How can we help them reunify? We also do a ton of support for foster families. We have a program called Foster Well. So if a foster parent has just taken in 3 kids and they're waiting on the stipend from the state, they can come to us and we can give them placement kits and clothing, maybe a meal, whatever you need just to get through that first week or 2, because it can be very overwhelming to all of a sudden take kids into your home.
Yeah, I bet.
Yeah. And then our 3rd program is called the Heart Gallery of Alaska. So children in foster care who are waiting permanency or adoption. We actually don't know how many kids in the state are like that. We have about 20 on the Heart Gallery right now. And those are kids that have chosen to put their story and pictures out there to advocate for their own adoption. So we kind of target all 3 parts of child welfare: prevention through Safe Families, support if they're in foster care through our family support services, and then if they need adoption, through the Heart Gallery.
And this is all the way from infancy up to 18?
Yes, it is. Yep. And then we also have a thrift store that we repurpose donations to either help fund our mission or to pass along to families, biological families, foster relative placements, and adoptive families.
And how long have you been in this field working specifically in foster care?
So after the kids transitioned out of our home, I had heard about Beacon Hill, and I knew that they were a private organization that did something to engage the community. So I actually reached out to them and just said, we've just come out of this kind of challenging experience. Can I help? And I started out as a volunteer. Then they hired me into the Safe Families program, and at the time they did not have an executive director. So within about a year, the board asked if I would step into that role. So I've been doing that since 2018. So really doing foster care work from the time we took in the kids in 2015, but in this role since about 2017.
What do you love about your job?
Oh my goodness, there's so much I love. I love the passionate team of staff and volunteers that we have, and just everyone coming from a place of they just want to show love and care and help strengthen and support families and keep families together. I love engaging the community in this work because I think a lot of people don't even know that this issue exists in our state, and it's a huge need. And I think a lot of people just aren't aware of that. So I love raising awareness. I love advocating for these kids and families. And I love, the one-on-one stories where we're really making generational change for these kids. And, seeing them either stay out of foster care and stay with their family in a healthy way, or a child who's been in foster care for 10, 12 years find their forever family. So it's those stories that keep me going.
Oh, man, I bet.
Yeah.
Do you have a particular story that stands out of a placement or a reunification? There's probably so many.
Oh, there's so many. One that comes to mind is it happened at the end of last year. It was a mom who was in Anchorage because her baby had medical needs. Excuse me. And then while they were here, the mom became sick and needed hospitalization, and dad was out of state military. And so they were faced with, where does this baby go that has some medical needs, but she's out of the hospital. And so we were able to take care of that baby just for a couple of days and help dad fly back. And he is so grateful. He sends us pictures and just 2 days of support. Somebody took care of his baby, and it kept that child out of foster care and provided that support. And he's just so grateful that someone cared and just took care of his baby and his wife for a couple of days until he could get back to the state. That's just one of many stories. I don't know. I could tell you so many.
No, I love that 2 days.
Yeah.
That shows the impact and the difference it made for that dad to be able to get here.
Right, and it doesn't take much. I think it can feel really overwhelming. There's almost 3,000 kids in care, and there's hundreds of families that we consider at risk, and it can just feel really overwhelming and not sure what to do. But we believe that everyone can do something, from drop off a meal to a new foster family, or take in a child through a safe home. I mean, that's kind of extreme, right? You get the opposite sides. Become a foster parent. Support organizations like ours financially, knowing that we're doing this work directly. There's just so many ways. You can donate to our store, and that supports the mission. There's just so many ways that just regular people in our community can make a difference.
In doing this, where do you see that we would need the most need here in Alaska? Is it more foster parents, more people opening up their home? Is it the donations? Where do you see is the biggest need?
Right now, we're facing a crisis with foster parent shortage. I would say that that's the biggest need in our state right now. Through COVID, I think Office of Children's Services lost 400 homes, and they just haven't recovered from that. And the families that had been doing it forever and continue to do it through COVID are starting to, close their license and just say, we're done. We're done with this for now. So they continue to lose homes. And what's happening is then the foster families that are continuing to do it are getting more kids, kids with difficult behaviors or high medical needs. And so I would say that's probably the number one issue right now, not so much for Beacon Hill, but for the state. Yeah.
So if someone listening wants to get involved, become a foster parent, what do they need to do? What would be their next step? What is that process like? What's that timeline look like?
I would say the next step is to go on that website, acrf.org, and it literally at the top of the page says, I want to become a foster parent, and it just walks you through it. It can not take a lot of time. It involves an application, an orientation, a core training that you go through, and then OCS comes in and certifies your home. They check for safety. They do background checks, of course. So for us, because we were emergency licensed, the kids were placed in our home one day, and then over the next month or two, we went through the process. But I would say normally, start to finish, if you were just going to kind of start cold, it takes a few months, up to 6 months, to kind of get all the paperwork done and references and training and those kinds of things. There are some great support networks out there. There's Facebook groups for foster parents. We have Foster Well. There's Volunteers of America that does a lot of relative placement support.
Yeah.
So there's some great partnering agencies out there that are really trying to support these families as they say yes to this really hard ask.
And if someone does become a foster parent, they go through the system, they're approved. Do they have a say in how many kids that they want to have in their home, the age?
Yes, in theory.
Okay, yeah.
But because there's such a crisis, I think what's happening is the current foster homes are being asked to do more. And so that's partly what kind of burns them out. They say we only want 1 kid or 3 kids or these ages, but because the need is so incredibly high, I think they're getting asked outside of that purview. And many times saying yes because there's literally no other place for these children to go.
Talk about some of the stigmas around foster care in the system. A lot of people maybe see on the movies and they think kids are going into foster care. They're taken from their homes and they just go to this facility. What does that look like here in Alaska, or more specifically Anchorage?
Yeah, I think there are some myths out there about what foster care is. You hear a myth like, oh, they're only in it for the money. They make like $27 a day. I mean, it is not making them money. It's really quite a small stipend. I think the other myth is that, you hear the horror stories, right? About maybe the bad foster homes. And the vast, vast majority of foster families are doing this out of the goodness of their heart and because they love kids and love families. And, there's the few that get out there that get the news attention or the stories. But, we work with foster families and relative placements all the time. And they are just doing it because they care and they're doing the best they can. And they really love these kids. And, I think another myth is that the bio parents are bad. And, and I think... a lot of times, like I said, it's neglect, and they just didn't have the social support that they needed to safely care for their kids. So, hopefully coming at it from a point of how can we support these bio parents and doing what they need to do to get these children back. It's less than 50% of kids who enter foster care return home.
That's what I was going to ask about the reunification process is, do a lot of them get to go back home?
Less than 50%.
Less than 50.
Yeah. Whereas conversely with our Safe Families program, which is 100% prevention, 99% of the time they go home. So if we can prevent them from going into foster care in the first place, there's a much higher chance that family stays together. So, and, less than 50%, that's not very many kids going home. So if we can encourage them and encourage the parents and give resources and surround them, hopefully more kids can return home, once the parents do what they need to do to be safe.
And sometimes that's all they need. I bet you run into the fact of families having that fear that their kid's going to get taken away, and really all they need is a little bit of support.
Yes.
Wow. Rural Alaska, does that play a factor in with you all and what you do as well?
Yeah, definitely. There's... Unfortunately, sometimes what happens if the kids are removed in a village, there may not be a safe place for them to be there, maybe not a foster home, so they get sent to an unknown community. And like Anchorage, so if we could avoid that and help encourage families within the rural villages, I think that would even be better. Let's keep kids where they belong within their culture and within their families would be ideal. So, we try to partner with tribal partners to help make that happen and support those families, even in rural communities.
What would you say to a family or someone that's listening that thinks this is a process that they want to go and become a foster parent, going through the process? Is there anything that they need to be prepared for? How do you know that might be a good fit for you or may not be a good fit for you? Or is, that kind of an open-ended?
I know, it's hard. I think you just have
what to be most prepared for, You
have to really be prepared for the lament and joy of the journey, right? Like there's so much joy in it, and you know that you're pouring into these kids and hopefully making a difference for these children and families and providing them a safe, healing place. But there's also a lot of lament in that and a lot of trauma, and it can be really, really hard and isolating. I would say if you're thinking about doing it, make sure that you have your own social network and circle of support, because you're really, really going to need to rely on those people for respite, for breaks. I know when we took in the kids, our church family surrounded us and brought us meals and a dresser and, winter gear and everything we needed to take care of these kids. And they would also do respite for us when we were, feeling like we needed a break. So I think don't go into this thinking, I'm going to save the world. I'm going to save these kids. I can do it all by myself. You just can't. You just really need a good social support system to do this work. So that'd be my biggest, I think, tip. If you're thinking about it, make sure you have your own circle of support first.
Do you find that a lot of folks who take in some of these foster kids have kids of their own, or some people don't have kids and they do well with that as well?
I mean, we've seen it all. We've seen single parents become foster families, parents without kids, parents with 10 kids, it just, the whole gamut. Yeah.
Wow. What would you like to see here in Alaska? We talked about the need and some of that, getting the word out about foster care in Alaska. It's one thing to kind of talk about it. We love everybody that would be listening to this podcast. How do you get the word out more about foster care in Alaska and the need that's here?
Yeah, it's partly things like this, partly word of mouth. I think part of the trouble is that foster parents right now are feeling really burned out and stretched, so they're maybe not the best people to advertise, come do foster care. But really, word of mouth is a lot of it. I think it is such a need. I think just even raising awareness, just if you're listening to this and you didn't know that there was this many kids in foster care and you didn't know that there was a foster home shortage, and maybe you're not the person that can take in kids right now, and that's okay. But maybe raise awareness and say, did you know that there's, kids out there that are waiting to be adopted? Do you know that there's families on the edge that maybe are living in their car and just need a circle of support? So raising awareness, I think, is a big one. Financially supporting good organizations that are doing this work is another way. And if you know of someone fostering, or you know of a grandparent that's just taken in kids, call them up and say, how can I support you?
Yeah.
Can I drop off a meal? Can I take your own kids for a night so that you get a break? Can I provide respite? Don't hesitate to step in and help, because I can guarantee you they will be grateful.
And for those that are familiar, speak a little bit about what respite is when you do become a foster parent. What does that necessarily mean?
So it's just basically giving you a break. Unfortunately, Office of Children's Services right now doesn't have respite homes. They're working on that, but it's not in place yet. So you kind of need to find your own respite. You need to find your own people that are going to give you a break. And it's 24/7 when you say yes to foster parenting. Sometimes the children have childcare or school or whatever, but you're just going to need breaks. And so it's also an issue in our state right now that we don't have enough places to provide respite. It's something we're working on. It's something Office of Children's Services is working on, but right now it's a gap.
And how important is that relationship for the foster parents to have with the agency, to stay in constant communication and to voice, hey, I do need a break, but I still want to continue in this, or I need some support?
Yeah, and I think that's where we come in, honestly, because right now the Office of Children's Services is operating at a staff deficit, and as many places are, right? They have a staffing shortage. And so sometimes that social worker isn't as available as that foster parent needs. And so that's why it's really important to have that social network first. And also sometimes people reach out to us and say, my social worker isn't as available to provide these needs, or where do I go for this? So while, yes, it is important to have that relationship, sometimes it's not as available because of the staffing shortage.
For you in this field now, do you think back to when you took in those two kids? What made you just go, yes?
Oh, my goodness. I don't know.
Yeah.
My husband and I both just had a sense that this is what we were called to do in that moment, and we said yes. And we don't regret it, and we learned an incredible amount of things, and our children have learned from it, even though it was the hardest thing we've done. I think it is what prepared me to be in this role as executive director of a statewide organization now serving children in foster care all across the state. So it was a journey, but I think it was a journey that If I would have said no, I would have missed out on all that experience and learning about the foster care system personally.
What are some things that are in place for the kids that are going into the foster care system? You know, there's the support, obviously, for the families that are taking them in. It's a huge transition for these kiddos. What's that like for them?
It really depends. I mean, ideally, if they're old enough, maybe they're getting into therapy to help focus on their trauma. Sometimes the resources are short, though, and behavioral health services, that's another crisis in Alaska right now. And so sometimes that can be a barrier for people taking in children with high needs, because then they can't get the support that they need therapeutically. So in an ideal world, that child transitions into a home and gets the therapeutic support that they need, both from the family and maybe from a therapist and a teacher or a school counselor. They get concrete resources like winter gear and tennis shoes for gym and that kind of thing. And some of that the Office of Children's Services provides through a clothing stipend for that child. There are really some things built into it that help financially support. So it's a clothing stipend. They will help pay for childcare. So there are some built-in services to help that family take care of that child. But any child who enters foster care, it's a trauma, right?
Yeah.
And the statistics will tell us that even if you're in foster care for a short amount of time, you increase your every statistic. Dropping out of high school, incarceration, drug and alcohol use, mental health issues, suicide. So, it's our hope and that we can engage the community to support these kids to minimize or mitigate that trauma, even though it is a trauma regardless.
Right.
If we can step in and surround as a community and as foster parents, then I think hopefully we can mitigate that trauma for them.
Is there something you could say to people who would look out for signs of, hey, I should probably make a phone call, or maybe this family might need additional support?
Yeah, I mean, we've all maybe come across that, right? Like a neighbor, and we're concerned about a child, or we hear something, or a child comes to school and discloses something. I lean on the side of make the call. You can even just call the OCS hotline and say, I'm concerned about this child. Is this even reportable? And they'll tell you, like, oh, yeah, that sounds like it's reportable. I would rather be safe, I guess, than sorry. The Office of Children's Services does get about 2,000 calls a month.
2,000 calls a month?
Yeah.
Oh, wow.
Yeah. So, just make the call
and
just say, hey, I'm concerned about this. Is this something that I can even report to you? And they'll let you know if it is.
Well, you have certainly delved into this topic. I know this is definitely something that is very passionate. You can hear it, and thank you for what you do and for shedding light on it. In wrapping up, I will give you the last thought. Is there anything that you would like to share or ask or mention that I didn't ask you?
I do believe that parenting, like I said, is the hardest job on the planet, and we need community. We need a circle of support to do it. Especially in Alaska, where we're even more socially isolated. Many of us are raising our kids without family nearby. And so just look out for, watch for, develop that social network, be brave and courageous, and because your whole family and your children are going to benefit from that.
I love that. Well, thank you, Kristen, for coming on and sharing your story with us for parenting in the far north. We appreciate it.
Thanks for having me.
And thank you all for listening. So be sure to like and subscribe.